main times that kids need vaccines for school is 4 to 6 years old. So we like to get them done before they go to preschool or kindergarten, whichever one the child's going to, so that they're well protected when they're in that classroom. And the shots that they'll get are diphtheria, pertussis, and tetanus vaccine called a DPT. And with that, they'll get an injectable polio vaccine. Sometimes those are part of the same shot. They're also due to get their measles, mumps, rubella vaccine and varicella vaccine. Those are all boosters of shots that they got when they're younger. So those shouldn't worry anybody. They've already had them before. If they've had any issues with those vaccines, we'll already know about it. So there should be no problem with those kids getting those vaccines to start school. The other ages that we routinely give vaccinations is around age 11 to 12. So that's when kids are entering middle school. What's due then is a meningitis vaccine to prevent meningitis, which is a horrible disease, a bacterial disease that affects the brain and so on. That vaccine is given at that age, along with what's called a Tdap, TDAP, which is just a different version of the one I just told you they needed for kindergarten. They have it's done set a little differently because it has different amounts of those same antigens in it. There's a little more tetanus, a little less pertussis, a little less diphtheria in it because the older kids have already had those vaccines before and they don't need the higher doses. That's the same, actually it's the same vaccines that's used for adults currently, that's called the Tdap. So they need their meningococcal vaccine, their Tdap, and the other newer vaccine, although it's not brand new, is the HPV, human papillomavirus vaccine that prevents cervical cancer and oral cancers and so on. And it's recommended that we give that at around age 11 or 12. That vaccine is a series of 2, unlike the other ones, it's a one-time. So that vaccine, you get the one vaccine, and then about 6 months later we give it the second dose. You wait till the child's a little older to get their HPV, like age 14 to 15 and higher. We do require 3 doses because apparently if you get a little older, some of your immune responses aren't as good as they were when you were younger. So we're able to get by with just 2 doses with the younger kids. That's recommended for both boys and girls.